first want to say a big thank you to NAM for lending us this space and for the incredible work that they do, Northwest Assistance Ministries. And it's just a fantastic day. I'm here joined by Commissioner Ellis, Director Robinson of our Public Health Department, Sergeant Raymond Lamello from the Sheriff's Office, Deborah Moore from the Houston Health Department, and they'll speak after my remarks. This is a major announcement on a major achievement in the fight against gun violence in this community. I want to thank Commissioner Ellis for being the first one to say we have to invest in these kinds of programs and make sure that we saw it through. To Director Robinson for pulling this all together. I've met some of the team members, Director Robinson. I am recruiting Ms. Washington, whom we're all very excited about, and I know this is going to be a big program for us. Sheriff Gonzalez, I know, is here in spirit, and to Sergeant Lamello, I want to say thank you to the entire department for working with us in partnership on this, and of course the Houston Health Department. We cannot address this crisis if we can't work together, and the mayor and I are hand in hand in tackling this challenge. Across the nation, states, counties, cities of all stripes have been facing the crime wave that we're seeing here in Harris County as well since the pandemic's onset. And we, of course, have not been able to escape this trend. But there's one particularly troubling thing that all of these violent crimes have in common, not just here, but elsewhere, and that is the presence of guns. We have to call this for what it is, and that is gun violence. Too often, weapons of war that have no business being on our streets are being used to murder people, to murder law enforcement officers as well. The gun lobby puts their interests ahead of those of the community, and people who shouldn't have access to weapons of war have access to them. This has to stop. In the meantime, leaders of all levels of government have tough decisions to make. Do we stubbornly double down on the same old law enforcement strategies, the ones that we know lead to mass incarceration and not necessarily more safety? Or do we follow the data and the evidence to implement the approaches that include law enforcement and community work and thoughtful, very tough, but also very smart initiatives? In Harris County, I'm proud of a commissioner's court that isn't afraid to look at the data, to look at the results, and act accordingly, even if it doesn't sound as good, but that we know it's going to make a difference. We're being tough on crime, and we're being smart on crime. Just yesterday, we approved a $1.4 billion budget for justice and safety. That's billion with a B. 400 vehicles for the sheriff and constables. Salary increases and overtime for the district attorney. $250,000 for pay increases. 60 additional jail detention officers. Additional constable patrol contracts. We also gave a 5% raise to all frontline deputies over the next 2 years. But what doesn't get the attention it should are so many other initiatives that we've also launched and have been investing on for many years since we've been in office, the past 3 years. That is our work on making sure that we have the most thoughtful, smartest solution on the ground. Too often, law enforcement officers find themselves on the front lines of societal issues that are beyond their scope, that they are not equipped to deal with. Poverty, addiction, mental illness. We listened to that challenge. Just last August, Commissioner Ellis, Commissioner Garcia, and I approved a major financial investment, $11 million, in launching 2 major initiatives with our trusted law enforcement partners. And they enthusiastically endorsed these 2 programs, the Holistic Assistance Response Team, or HART, and the Community Violence Interruption Program. Let me start with HART. According to Everytown for Gun Safety, fewer than 4% of 911 calls are related to violent crime, even in cities with high homicide rates. We owe it to police and to our communities to make sure that those law enforcement officers can be out there patrolling neighborhoods like neighborhoods want to see, like communities want to see, as opposed to responding to calls that other kinds of professionals can respond to. I'm proud that we're able to launch this program here in Cypress Station, which has been hit so hard by violent crime. So the idea is to have professionals, experts on mental health and substance use disorders respond to the calls where they can focus on that and ensure that our police is focusing on the violent crime that plagues this community. The HART teams are working closely with the Harris County Sheriff's Office, making sure that they're exchanging all the information, that everybody knows where to go, that we're not leaving any gaps, making sure that they're providing services complementary to law enforcement, that they're listening to what law enforcement is seeing, and folks that have been patrolling these areas for so long. The HART teams will consist of trained social workers, behavioral health, medical professionals who can provide appropriate response to folks experiencing homelessness, behavioral health issues, mental health crises, or other non-emergency, non-violent social issues. HART will begin operations with our Sheriff's Office this spring, this March. And over time, we anticipate having several of these teams around the county. It is a $5 million initiative, and it supplements the type of work we have right now where law enforcement is responding to the mental health calls. Another Smart and Tough on Crime initiative we're very proud to announce today is our $6 million Community Violence Interruption Program. And this zeroes in on that tit for tat that leads to gun violence, that leads to murders too many times. The team connects with people at risk. It identifies individuals, it identifies communities, maybe even gangs, folks that are most highly impacted by gun violence, including hospital patients who have just been shot, to go and visit them in the hospital and say what is going on and work with them with expertise to be able to stop that cycle of gun violence before somebody else is hurt or loses their lives. We're targeting the root causes of gun violence by assigning caseworkers with a variety of disciplines, mental health counseling, substance abuse, employment. We help people escape gangs. We enlist community leaders, respected community leaders who have been through this, to speak to folks who are right now in the middle of this tit for tat. We stop violence before it happens. We resolve neighborhood conflicts peacefully, not through a weapon. That's the goal here. To be clear, neither the HART initiative nor the Community Violence Interruption Program are experimental. There are many studies that show the impact of this in many communities where this has helped reduce violence from what it would have been otherwise. Two examples: the Harvard City Solutions Program and the Journal of American Academy of Psychiatry has documented the success of mental health crisis response teams like HART in communities across the country. As far as the Violence Interruption Program, according to the Annual Review of Public Health, these kinds of programs have much greater success in ending cycles of violence than just incarceration alone, and the numbers are there for folks to see. There are those cynical folks who would have you believe that we have to choose between cop-centered solutions or community-centered solutions. But the truth is they go hand in hand. Our officers in Harris County believe in working with the community and working with public health and working with our city and across all law enforcement agencies. We need to tackle this together. We need to focus on what works. We need to put aside the rhetoric, and that is what all of these folks are ready to do at a time when it is scarier than ever. And so I want to thank all of the law enforcement officers supporting this program and in general for their incredible work, of course, their families, and I want to make sure folks know we are committed to focus on both things: to work on community, to work on policing with the common goal of public safety. It is hard work, it is expensive work, but since we got here, we have increased law enforcement and safety spending on these smart, tough solutions, and we're going to continue to do that. So far, all of the increases have gone to all 8 constables' offices, the sheriff's office, and the district attorney's office. Thank you for joining us today and marking this milestone. We're very proud, very excited, and we'll be watching the results closely. I'll repeat in Spanish. Primero agradecerle al comisionado Ellis, quien fue el primero en decir que necesitábamos un proyecto como este y en asegurarse que lleváramos a cabo el proyecto. También a la directora Barbie Robinson, quien ha liderado esta iniciativa. Está aquí el sargento Raymond Lomelo representando la oficina del alguacil y finalmente Deborah Moore, quien representa la oficina de salud de la ciudad. Estas iniciativas son unas iniciativas en sociedad. Requiere trabajar juntos, cooperar. Eso es lo que estamos haciendo tanto con la oficina del alguacil como con la ciudad de Houston. El alcalde y yo estamos trabajando mano a mano muy de cerca en este tema del crimen. A través de nuestro país, todos los estados, muchos condados, ha incrementado esta violencia y específicamente hay que llamarla lo que es. Es violencia armada. Es violencia armada por tantas armas de guerra que no tienen nada que hacer en las calles, en los vecindarios de una comunidad residencial y una comunidad como nuestro condado. Con demasiada frecuencia vemos los intereses del lobby de armas enfrente de los intereses de la comunidad. Eso es terrible, tiene que parar, pero por mientras estamos enfrentando decisiones muy difíciles. Duplicar obstinadamente las mismas prácticas de aplicación de la ley que no han logrado que seamos más seguros, pero sí llevaron a encarcelamiento masivo en este país, o implementar iniciativas con evidencia que sabemos van a ayudar a solucionar el problema y no van a perjudicar a tantas comunidades. En el condado Harris me enorgullece ser parte de una corte de comisionados, de un liderazgo que está muy comprometido a los resultados, a ver qué dice la evidencia y hacer eso, no solamente decir mano dura sin ningún significado alguno. Nuestra estrategia es ser tanto inteligentes como agresivos contra el crimen. El día de ayer invertimos 1.4 billones de dólares, con B, más de $1,000 millones, en temas de justicia y seguridad. 400 vehículos para los alguaciles y los constables, incrementos para la fiscal, fondos para los trabajadores en la cárcel, los oficiales de detención en la cárcel. Le subimos el salario un 5% a todos los oficiales que trabajan en las comunidades, tanto del alguacil como de los constables. Pero también hemos venido trabajando en iniciativas adicionales y esas son las que vamos a anunciar hoy. Adicionamos 2 iniciativas más. Con demasiada frecuencia, los oficiales, se ven en la línea de frente de problemas societales que no están equipados para lidiar. Por ejemplo, salud mental, pobreza, adicción, esos son temas que no le corresponden a un policía que debe responder a actos violentos. Desde el año pasado, el comisionado García, el comisionado Ellis y yo aprobamos una inversión mayor, $11 millones, para atacar este reto. La primera iniciativa es HART. Esa iniciativa es los equipos de respuesta de asistencia integral. Son equipos que van a responder a llamadas de salud mental, a llamadas sociales, llamadas no violentas, que el día de hoy toman mucho tiempo de la policía. Lo que quieren nuestras comunidades es ver policías en su vecindario, respondiendo, observando. No quieren ver a los policías enfocados en temas de pobreza o salud mental, sino en los temas más violentos. Entonces, eso es lo que va a permitir este programa. Lo estamos lanzando en Cypress Station, donde hay una tasa de crimen más alta que en casi cualquier otro lugar del condado. Los equipos serán trabajadores sociales capacitados, profesionales médicos, profesionales de salud del comportamiento. Son $5 millones para ese programa. El segundo programa es la iniciativa de intervención de violencia comunitaria. Esta iniciativa hace lo que dice el nombre, básicamente asegura que no haya esa violencia que responde a una violencia inicial. Trabaja en las causas fundamentales de la violencia armada, trabaja con pandillas, con trabajadores sociales, inclusive visita los hospitales para ver cualquier persona que haya sido herido por una bala, por un disparo, intentar resolver la situación de una manera pacífica para que no continúen esas guerras entre pandillas, esas guerras entre individuos que suceden con las armas de fuego. Ese es un programa de $6 millones y va a llevarse a cabo en 3 vecindarios, en Cypress Station, también en Sunnyside y también en el hospital de Benton. Para ser claro, ninguno de estas iniciativas, ni la iniciativa HART, ni la iniciativa de intervención de violencia comunitaria son experimentos. Ambas iniciativas han sido exitosas en otras comunidades, han sido muy estudiadas por académicos muy serios, por ejemplo, el Journal of American Academy of Psychiatry y también el programa de soluciones de ciudades de la Universidad de Harvard ha demostrado resultados de iniciativas como HART. Además, el Annual Review of Public Health es una de las publicaciones académicas más respetadas. Ha demostrado que programas de intervención de violencia comunitaria tienen una tasa de éxito en romper ese ciclo de violencia mucho más eficiente que simplemente el encarcelamiento. Hay gente cínica que va a decir que hay que escoger entre policías y soluciones enfocadas en la comunidad. Pero la realidad es que podemos hacer ambas cosas. Tenemos una fuerza policial en este condado que trabaja muy bien con la comunidad, que está comprometida a trabajar con trabajadores sociales, con el Departamento de Salud Pública, con la ciudad, a través de todas las agencias, con los hospitales, para lidiar con este problema. Y vamos a lograrlo. Quiero darles las gracias a tantos policías, tantos oficiales. En estos días este trabajo se vuelve aún más peligroso, pero ellos siguen aquí comprometidos, listos a trabajar por la comunidad, listos a romper estos ciclos de violencia. Me enorgullece trabajar todos juntos en esto. I'll hand it over to Commissioner Ellis.
Thank you, Judge, and welcome back to Cypress Station. We were just in this neighborhood last week. I also want to thank our hosts, of course, with the Harrell Family Opportunity Center celebration, and I want to thank the folks at Northwest Ministries. I appreciate all of the work of law enforcement. As the judge said, we cannot stress enough how important law enforcement is. It's good we're here because the ministers in these 2 pilot neighborhoods play an important role in making these 2 important programs work. These 2 programs are 2 additional tools that we're adding to the toolbox to help our law enforcement officials. Public safety is a top priority for everybody in every jurisdiction in this country. There's an uptick in certain areas of crime in virtually every urban area of America. What we're doing is announcing these 2 programs, additional tools in the toolbox that have been tested around the country. They may be new to us, but they're not new to the country. I appreciate the sheriff and the police chief for both being supportive of these programs. I'm glad that the city is here. We're in unincorporated Harris County now. One neighborhood that we're targeting is in the city, Sunnyside, which is where I'm from. The other one is this neighborhood. It is a pilot program. In reference to the Holistic Assistance Responder Program, I just want to mention a couple of other stats to make the case. They've been tried in other places and they're working. Denver's program is called STAR, Denver's Support Team Assistance Program. The team was able to resolve calls on an average of 6 minutes faster than law enforcement. That means they were helping law enforcement because they have a HART program. 34% of their calls originated with law enforcement who showed up at the scene and then asked for the STAR folks to come in and take over the work. In terms of violence interruption programs, the statistics show that they have worked in other parts of the country. Programs like the one in the South Bronx, they had a 63% decrease in shootings and 30% reduction in gun injuries in the South Bronx. In Oakland, 7% reduction in likelihood of arrest following a violent injury and hospitalization. 0 re-injury rate in an Indianapolis hospital-based program. 55% reduction in gunshot wounds and killings from 2007 to 2019 in Richmond, California. In Stockton, California, it was once the 10th most dangerous city in the country. Its street approach outreach program led to a 20% drop in gun homicides and assaults and saved the city between $42 million and $110 million. I'm convinced, as the judge is, that these upfront investments will save lives and save taxpayer money. It's important that these programs work. I am so glad that both our police chief and our sheriff wanted these programs to be based somewhere other than their offices. In no way is it a lack of interest in what they do. I don't think anybody on the planet, particularly in this country, has a more difficult job than our law enforcement people. We appreciate you, and we're all in this together. With that, I want to turn it over to Barbie Robinson, our health director from the city of Houston.
Good afternoon, Barbie Robinson, Executive Director of Harris County Public Health. Thank you, Judge, for being here today, and Commissioner Ellis, and our partners who are helping lift these two very exciting initiatives. Harris County Public Health is eager to stand up and administer these two programs. As the judge said, violence in our community is a pressing issue. Harris County Public Health views violence as a health issue. And with that, it requires public health approaches be added to our toolbox in terms of how we're addressing violence in our communities. And so today, with our announcement of the Holistic Assistance Response Team and our Community Violence Interruption Program, we are eager to bring a public health approach that addresses the root causes of violence, looking at those factors and stressors that contribute to an individual's likelihood to be a victim of violence or a perpetrator of violence. And we know that when we address the root causes of violence, economic instability, food insecurity, housing insecurity, when we look at holistically what the needs are of individuals that are victims of or perpetrators of violence, and we bring a holistic approach to their needs, we're able to establish a life trajectory that is an alternative to a life of violence. And so with that, today we want to talk about the Holistic Assistance Response Team and the efforts that they will have underway in Cypress Station. We've chosen 3 locations, 3 beats, and Sergeant Lamello can speak more about that, where we're going to be focusing on a set of calls where our law enforcement staff, our 911 dispatch staff have identified those calls as calls that do not warrant law enforcement response, but rather more holistic approaches to addressing the issues and crises that individuals are facing in our community. The Community Violence and Interruption Program, we're excited and eager to bring those programs to Sunnyside and Cypress Station, where we're working with individuals, our outreach specialists, who have relationships, deep relationships in those 2 communities that will be working with individuals on the ground to help facilitate disruption of violence. We know that we need a continuum of solutions, looking at interventions, prevention, and response, and that is really the role of our law enforcement, to respond in those violent efforts. But we know with a public health approach that there are opportunities for us to prevent violence, to intervene and address the root causes of violence. And so with that, I will turn it over to Sergeant Lamello.
In June of 2020, a request was made to analyze the feasibility of a non-law enforcement responder program. This is the culmination of that effort. Before I discuss those findings and our direction, let me speak to our agency. The Sheriff's Office prides itself in protecting all the lives in Harris County and preserving peace every day. Our core values are merit and maintain the public's trust, embrace and deliver professional service, protect our citizens with honor and courage, exemplify ethical conduct at all times, and to develop and encourage and care for our Sheriff's Office family. In addition, we endeavor to build trust between our agency and the community. The Holistic Assistance Response Team, known as HART, is an important partnership that illustrates how our agency and public health are able to work together to enhance the safety and the resources for the community, all of Harris County. Here in Harris County, we have a significant number of calls that are nonviolent. HART intends to ensure that most appropriate responder is assigned to those type of calls. Each of these multidisciplinary teams will have trained professionals who specialize in social services, community, and mental health. Every resident and every call matters to us. The HART program will allow our agencies to better respond to and serve the needs of our residents. Hopefully, HART program will provide the appropriate response and interventions when called upon. How will this look? When the Harris County Sheriff's Office Emergency Call Center receives a call regarding a nonviolent incident, these things could look like substance use issues, homelessness, mental health, or social welfare issues. The specialist from mental health, public health, will be notified and work with our staff to respond to that situation in the field. The Sheriff's Office has identified 3 patrol beats in and near Cypress Station, and that have the highest volume of nonviolent 911 calls. It's a very high level of 911 calls, period. Ideally, the plan is to expand the program and ensure that other areas of Harris County will also have specialists from HART responding to their areas. The deputies of the Sheriff's Office are well trained in crisis response and de-escalation, and they will continue to do everything to make sure incidences are handled peacefully and with professionalism. This effort will allow law enforcement to focus their energies on higher priority calls. Allow me to introduce Houston Health Department Director Deborah Moore.
Thank you. Good afternoon. I bring you greetings from the City of Houston and the Houston Health Department. And we are so pleased to support Harris County Public Health's Violence Prevention Initiative. Violent offenses come in several forms, and we need several solutions to help our community heal. We need to be able to address and disrupt incidents before they happen. The more services available to help residents and reduce the stress on law enforcement, the better our community can become. It will take this type of collaborative community approach between partner agencies to address this challenge. As my colleagues and partners have said, the HART program has proven successful in various parts of the country, and bringing it here into our county will bring significant change in how we address these incidents. This county initiative, both county initiatives, are in line with new and existing community violence interruption programming at the Houston Health Department. Our Bureau of Youth and Adolescent Health works to change outcomes of young people's interactions with the law enforcement and with the criminal justice system. We will have a credible messenger program where we will engage credible messengers, people in those communities, to serve as community guides, mediators, and mentors. We're also implementing a Cure Violence program because, as Director Robinson said, we do view violence as a public health concern. So we're implementing a program to cure the violence in our communities. We will train and deploy outreach workers to mitigate conflict. And we're also expanding a program that we've had in-house for several years. It is our reentry program. The expansion of our reentry program will provide we will be able to provide an additional 250 formerly incarcerated individuals with services and supports that will aid them in successfully re-entering and becoming productive citizens of their communities. The Houston Health Department programs that I've just mentioned are all a part of Mayor Turner's One Safe Houston plan to reduce crime. Together, these city and county initiatives work to reduce crime, lower the burden on law enforcement, and reinforce the health of our communities. The Houston Health Department looks forward to partnering with Harris County Public Health to coordinate these violence prevention programs throughout Houston and Harris County. And now I'll bring Director Robinson up.
We'll take any questions.
Ayer, en cuestión de horas, una adolescente de 13 años por el área del suroeste, baleado 3 veces, un transeúnte arrollado cuando iba huyendo sospechoso, y también a las 9 de la noche una madre sufre también que le balearon a su hija de 9 años, que también fue transportada con él. Esto ya llegó a extremos de que los niños están siendo víctimas. ¿Qué podemos hacer a esto? O sea, ¿a dónde vamos a llegar?
Son tragedias espantosas, o sea, es algo que nadie debe pasar por ese tipo de tragedias. Obviamente el elemento constante a través de cada una de esas tragedias son las armas de fuego. Entonces, vale la pena recordar que pasó una ley que hace todavía más fácil el obtener armas de fuego, armas de guerra, ni siquiera una pistola normal, armas de guerra. Prácticamente cualquier persona puede obtener una en el estado de Texas. Entonces, esa es parte del reto. Ahora, sabiendo que ese es el reto, igual no nos vamos a dar por vencidos. Obviamente yo no controlo las leyes del estado, pero eso no significa que me lave las manos. Por eso estamos trabajando en muchas distintas iniciativas que llegan al mismo resultado. La iniciativa de hoy, que también está trabajando la ciudad, intenta limitar esos ciclos de violencia. Algunas de estas vidas inocentes son individuos, niños, que se encuentran en medio de una batalla entre adultos o adolescentes que andan peleando con esas armas de fuego. Entonces, este tipo de programa ayuda también a reducir esa probabilidad de que un inocente, menos un niño, se encuentre en medio de una tragedia de estas. El tema, por ejemplo, lo que hicimos la semana pasada, que seguimos implementando a través del condado, traer más luz, reducir áreas donde se reúnen los elementos criminales, el incrementar el número o las horas que pasan los policías en las áreas donde hay más crimen. Miren, hasta donde da el presupuesto se está invirtiendo en estos temas. Vamos a ver cómo funcionan estos dos programas. La idea es incrementarlos, pero igual es una iniciativa grande, 11 millones de dólares. No va a cambiar de la noche a la mañana. No va a cambiar de la noche a la mañana. Me duele el corazón escuchar de estos niños, las familias. O sea, es que no hay ni qué les podamos decir que vaya a regresar a sus hijos, a sus seres queridos. Pero tenemos que tomar un momento, decir, ok, ¿cuál es la manera más eficaz, más inteligente, más agresiva de atacar eso? Eso lo estamos haciendo, eso lo estamos haciendo. Yes, the question was about a young boy, 11 years old, who was murdered just recently. Another child lost her life. Various tragedies that continue to take place in this community. And look, the common element across all of these tragedies are weapons of war. I'm not even going to say guns because it's the type of weapons even that are on our streets. And I'd be remiss not to remind people that a law passed in Texas that took effect this year that makes it even easier for people, criminals, everyone, to pretty much anybody, to get their hands on a weapon of war, like the one that was used to murder a police officer just recently. And these little children. These are all tragedies. There's nothing I could say that's going to bring these kids back. And it breaks my heart for the families and for the community. What we're doing and what we're going to continue to do is figure out what is the most efficient, smartest, tough, but smart way to tackle these challenges. What we're announcing today, $11 million. These programs we hope will be expanded. I'm not going to pretend like they meet all the need, but they will make a dent, and the goal is to grow them. And $11 million is a big investment, and the city's doing their investments as well. What we talked about last week, tearing down buildings where criminal elements congregate, bringing lighting, the overtime we've put. So we now have folks from the sheriff's office and the constables that can go in to take advantage of this program, spend more time in the communities where there is violence. These violence interruption programs, that's the idea, is to stop this gun violence so there isn't an innocent child caught in the crossfire. These things are not going to change overnight. They're not going to change overnight. But we are investing every dollar that the budget will sustain into these kinds of smart and aggressive initiatives. We're going to continue to do that. I am confident that we're going to be able to turn this around. We need to stick with it. We need to not pander. We need to focus on what works, and that's what all of us here are doing. But my heart goes out to those families and those kids.
So when does this pilot program start? How long does it last? And what will it look like to folks who, I know it's starting in the Cypress Station. So if I live in that area and I call 911 because a family member is having a mental health crisis, who's going to be responding? What does that really look like?
So both programs launch in March, and the idea is to be able to see really what impact it has, particularly in Cypress Station. It's going to make a big dent in this area where we're seeing such an enormous concentration of crime. And then as far as the gun violence interruption, which is here, Sunnyside and Ben Taub, we'll be able to measure the impact